Welcome to another edition of Politics and Random. Egberto Willis, your host. Today, we're honored to have Dr. Dona Kim Murphey, MD, PhD. She is a neuroscientist, neurologist, community organizer, and also historian of science, race, immigration, poverty. She is a real activist in the field where we need activists. And I came across a message that she had on Twitter requesting information. And I said, this is something that we probably should jump onto. So first of all, welcome to Politics Done Right. Donna, how are you doing today?
I'm doing all right. How are you doing, Egberto?
I am doing great. I'm doing great as usual. You are always doing something in the community to make the lives better for people. Tell us something that you've discovered, and this seems to have affected you personally, your family personally. Let's go ahead and talk about that.
Sure. So I realized, I guess, a few weeks ago that for myself, I've had some menstrual irregularities that are very out of the ordinary for myself. And this is not something that people generally talk about very publicly. But within a household, I imagine that if you have more than one woman, that conversation does ensue. And I have two young women in my household other than myself. And so I asked my daughters actually if they had also noticed any irregularities. All of us actually are generally very regular, and I actually have been regular for over a decade. And so this was really uncharacteristic for me. I didn't really know what explained it, thought it was maybe just me until then I conferred with both of my children, and both of them attested to a change in the last month, which then suggested to me there was some kind of exposure that we had, whether it was like a new chemical cleaning product or agent that was being used in our household. It was something new that we were maybe consuming, something that was at least true of our household. But then it occurred also that it could be broader than that, right? This exposure could be broader than that. And so I started asking other women in our community, just in the neighborhood, down the street, and it seemed without any prompting, right? I just asked, may I ask you a kind of weird question? Have you noticed any menstrual irregularities in the context of having generally been regular? And I had a bunch of women tell me, well, that's a really weird question because yes, something has happened in the last month. And so then that further suggested that there was an environmental exposure. I'm not sure what that is, right? But it was something temporally correlated to having happened in early May, probably. And I thought about what happened in the last month. And the only thing I could think of, and then I corroborated, was that early May was the time of a chemical fire in Deer Park, right? There probably have been other things that have happened in that time, in that window. I'm just not aware of those things, right? And I want to be really clear that this is super preliminary, right? Like the association. That's why I wanted to actually put a survey out there to see if there are other women in our community and what is the extent to which geographic extent to which people are reporting these kinds of abnormalities recently. I was concerned because in that fire in particular, what we were hearing in the media was that there were hundreds of chemicals that were released into the air, but the one that was of major concern was this chemical called 1,3-butadiene, which is a known carcinogen, and it actually does cause reproductive toxicity. And so, those are really serious implications, and they're very long-term implications, things that we might not know are related, right? Unless we're tracking that over time.
Right.
So I wanted to kind of jump on that early to see, are there people out there who would be willing to share a little bit of information about themselves because they have an interest in seeing if something does develop over time?
Now, I think you created a Google survey that you're asking folks to share so that people will be able to fill it out and tell their stories if they've noticed these types of irregularities since May, after having been regular without problems, and also, I think, not on birth control or something to that effect, correct?
Yeah, the reason I added that, and it was difficult to word, and I think it's confused some people. In talking to folks, there are many women who are actually on some form of birth control, right? Whether it's like an intrauterine device that is hormonal, or it's actually something that's inserted into the arm that's hormonal, or oral birth control pills. Lots of women are on these different kinds of birth control. And so they don't actually have a regular period. But what they have noticed is that, they haven't had a period in 10 years, but in the last month, they've had some spotting. And that is unusual for them, right? And that also suggests something has happened that is maybe the same thing, the same exposure that those of us who do have periods regularly have also experienced.
So I imagine then the wording has to be that you just need to know if they are regular based on whether they are on, that you want the information from everybody, but you also want to be able to correlate that you are on birth control or you're not on birth control.
Yeah, I mean, maybe that's a question I should just explicitly ask. The reason I didn't ask it is because of kind of the politicized nature of that question. So I wanted people to kind of self-select whether they wanted to fill out the survey. And, if they've noticed any change, whether normally they don't have a period and now they are having a period. There are also women who have had hysterectomies, right? And so they wouldn't count because they don't have periods at all and they cannot have periods.
Right.
And also I should be inclusive as I can be. And so I tried to, I don't know if I worded it there ultimately in this way, but my intention was to really be inclusive of people in terms of their gender identity who might not identify as being women, but they do have periods as well. So it's really about people who have periods or who don't have periods as a function of being on some kind of birth control that have seen a change
over the last since that May period in time. I think that is important because a lot of things occur in our society and our environment that goes unnoticed or go unexplained, or they don't report on it, but it does affect people. And we have to be cognizant of all these particular issues. And it's great that you did that. Now, about this chemical, what is it called? Butane?
1,3-butadiene.
1,3-butadiene. Do you know if this is something that's long lasting? Does it stay in the bloodstream for a long time? Does it stay in the environment for a long time? Does it stay in the soils and water for a long time?
That's a great question. So I've not done a deep dive. In fact, when I realized this was at least of personal concern to me and my children, and then I realized it was maybe bigger than that. I was in the middle of actually testifying in DC for another thing. So that was yesterday, I guess. I put this survey out. Right. So I haven't done a deep dive. All I do know about that chemical is that it can embed itself like deep within the lung tissue. So if you inhale that chemical, it can situate itself there. And it's not clear to me how long it will stay there. And as far as how long it persists in the environment, I also don't know that. So those are things that I should read up on also to educate myself and maybe to put out there to the people, especially who filled out the survey, just as an FYI, this is what we know about this chemical.
Well, this is still in the research stages, and I'm sure that you'll get all of that down and come back on to discuss some of that. I mean, I think and Don, I think we probably should use this opportunity to explain some of the reasons why you do the kind of activism you do with the environment and else otherwise, because I think people don't understand that they have to be active participants in their own well-being, not only for themselves, but environmentally, which affects them and others as well.
Yes, absolutely. I mean, I think that we take too much for granted in terms of like industrial activity. I mean, in fact, this other testimony that I was doing, it was bringing some visibility to things happening in pharma, right? And I think here in Texas, we have a lot of relationships with the oil and gas industry, right? We may be personally involved in it as people who are employed by some of these companies. We may be part of government who have certain kinds of relationships with those companies. And I think that we need to be aware that the chemicals that they produce, in order for us to run our society, to be fair, right? Like we wouldn't be able to drive our cars if we didn't have those products. At least at this time, we're moving towards hopefully an economy where we can do that potentially without those products that are so damaging, I think, to our health and to the environment. But for the moment, we're very dependent on those companies. And so I think at the same time, we need to be educated ourselves about what the health implications are about, the products that they actually produce. Yeah, I mean, it's kind of scary to me that we can't be honest with ourselves and each other about that, right? I mean, there are kind of advantages and disadvantages to almost any decision that you make in life. And I think the honesty around the health consequences of what we're doing in the oil and gas industry is so essential for us to be able to take control of our own lives, right? Even in the face of this whole mammoth thing that we feel like as individuals we cannot control, having some knowledge, being educated about what our potential exposures are, and then even in some cases being able to use that information when we see that the health consequences are very widespread, like deep and enduring, then we can actually organize to try to change that. Right. Because some of it might be that like, okay, well, now we have the knowledge, but we're not able to change anything on our own. But when many of us have that information and we're all impacted in terms of the negative sequelae, then I think that there is going to be more impetus for us to organize for change. And right now, I think it's that a lot of people are just unaware, right? Or a lot of people just kind of think, that's the price that we pay, right? We live in a modern society. Oh, well, people are going to get cancer from these chemicals. I think that it's not an inevitability. I think that we can change that, but people do have to be aware and they have to be motivated to change it. Yeah.
And you bringing awareness to this opens the door for one of my pet subjects, if you will, and that is healthcare for all. I mean, we have a state where we produce a lot of these chemicals that harm, but at the same time, we also have a state that refuses as something as simple as accepting the Medicaid expansion to the Affordable Care Act, which for these people who will and who do get ill from the types of industries we have in this state, they don't have affordable healthcare that we already are paying for. In the United States. So what are your thoughts on that? First of all, from the medical doctor point of view, as well as from an activist point of view?
Yeah, I mean, I think that it's absolutely essential that we have an effective and a universal way to provide healthcare to people. It disproportionately is going to impact the same communities that basically get taxed with every social determinant of health. You know, when you don't have affordable healthcare, when you don't have a system that is universal, with this particular issue with the environment, right? Like we have known for some time that people living around those facilities who typically are lower income and from communities of color, that they are disproportionately impacted in terms of the health consequences of living around those facilities, right? Part of what I was trying to do with the survey, I think in trying to understand who is impacted in demographics, but also to understand the causal relationship between that particular incident on May 5th and what we're seeing now is to look at distance from those facilities, right? Which is why I asked the question of zip code, because that will give you some sense that if it's like diminishing incidence of symptoms from, related to the distance from that facility, then that gives you some information about potential cause.
Doesn't only give you a correlation, but it may also work on starting to develop causation.
Correct. And it gives you some information about who, in terms of demographics, is more impacted than others, right? We already know that it's the same groups that get disproportionately impacted in terms of access to healthcare, in terms of environmental toxin exposure. Everything in terms of access to good public education, everything. And I don't know. I think it's important at the very least to document. At some level, I'm like, how much harm do we have to actually prove to take definitive action on these matters? Sometimes it's kind of frustrating to me.
I think that's why what you do is so important, because what it allows us to do is start documenting things. One of the things that let's say the underclass, if you will, or those who are more affected by these issues have is they don't have the wherewithal to document these things so that they can make a case of provability on these issues. When we have activists like yourself and others in the community, generating the necessary approach, teaching people that know you matter and know you can make a difference by taking some responsibility for engaging into solving into addressing these particular problems to make sure that those who can solve them. Your thoughts?
Yeah, no, I totally think that it is essential to document. I was surprised, some of the work that I've done in Pearland around just holding our school district accountable on various issues, mostly having to do with racial justice issues ultimately, but some other issues also, LGBT justice, a lot of other things have been going on here. But over about 3 years, I continually would bring press attention to some of the things happening in our community. And I thought, that was worth doing for the moment in which it was happening, right? So to galvanize people in that moment. But as it turns out, so ultimately I ended up suing in November of last year. I ended up suing our school district for single member districts for better representation, because we have, a 7-person board that is at this time all white. And we have our population is 65% people of color here. And so, this law firm actually has been very successful in other parts of Texas in winning these VRA lawsuits, these Voting Rights Act lawsuits. And I thought this is the place to do it right now. And so they came in, they agreed with us. They actually filed the lawsuit in November. And some of what they shared with me is that it is actually really helpful for people in the community to bring visibility to these issues to where there is documentation in the media of what is happening, because it is proof for them that they can then reference in lawsuits, right? And that never occurred to me as I was doing the work. I was doing it because I needed in that moment the support to be galvanized in the community. But long term, it has impact as well, because you build a case over time.
It is very important. And that's why I try to get this type of coverages continuously wherever we can. And that's why I also love the work that you do. Why don't you go ahead and give me a closing statement before we end this?
I think that it would be really helpful for women in the greater Houston area to fill out this survey about whether they have experienced any change in their menstrual cycle that is out of the ordinary. That's the important thing. So if you're normally irregular, it's not really that helpful. But if that is out of the ordinary for you in the last month, from early May to early June, and I don't know how long this is going to persist, right? But at least that it started at that time, that would be very helpful, I think, for us to start understanding what the relationships might be in terms of exposures from industrial toxins and some of what we may be experiencing as symptoms and potentially diagnoses in the future.
Now, Donna, I'll post your thing on the blog that goes along with this interview here. But is there a general place where you're going to place this for people to find, or we're going to do this sort of a viral distribution?
Yeah, I don't really have a place otherwise. Like I don't have a web. I mean, I guess I have a website from like my run for school board, but like right. I don't have a place.
Well, we'll get it out there. Make sure, first of all, we're giving it this here on KPFT as well as on other networks, as well as we'll make sure that to get the links for for that survey out. So Dr. Dona Kim Murphey, thank you so kindly for having been on Politics Done Right.
Thank you so much. It's great to be here.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.